I just want to have an opportunity to say that one of my oldest friends is a male who had breast cancer a few years ago, so I wanted you to just speak to it a little bit and remind people that it's not just a woman's disease.
So, before we answer that, I want to point out for those of you who may have seen it, the newest pin that we have here, the pink pin, it has a little blue dot, a stone, which is to represent the men with breast cancer, pointing out that we fund, BCRF funds research looking at causes of breast cancer in men. I don't know if Dan, or do you want to touch this? Go ahead.
Well, one of the interesting things about these powerful genes, BRCA1 and BRCA2, is that they increase the body's natural risk for developing breast cancer, and that applies to both men and women. It's just that the baseline is that much higher in women. So if 1 in 10 women might develop breast cancer, if you are unfortunate enough to have a mutation in BRCA2, for example, that risk may go up about 20-fold. It's the same for a man, except that there's so much less breast tissue, there's so much less estrogen in a man that the baseline risk is very low, but those genes can certainly cause an increase as well. So it's very rare. As you mentioned, it's not appreciated, but the mechanisms seem to be very similar.
But for example, I think we all now routinely send men who have breast cancer for genetic testing because the prevalence of the gene is so high. Unlike women, where we make a more discerning decision about who to test sometimes, here it's pretty universal.